I really appreciate it. And I appreciate you setting this up for us as well. So welcome. I'm pleased to have you here to learn more about the Master of Public Health program. I am Amy Buckenmeyer. I am the program director and an associate professor in the College of Nursing and Health Professions at Valparaiso University. Next slide, please. Thanks. So our program, our MPH program, is unique in the fact that it forms students as future public health professionals in global health and community health and health education. And so by focusing on an aspect of global health, looking at public health around the world, including a subset in the US, it really prepares students to dive into future roles in public health, either domestically within the United States or around the world. I'll go through the curriculum with you, so we'll learn a little bit more about how the global health aspect is met, how community health comes in, and also how health education comes in as well. So there are some pretty unique features. Obviously, Valpo is small. We have a very pay close attention to our students and our student progress. We develop more mentoring relationships than we do of kind of the old school top-down model. That's not where we are probably. That wouldn't be where we're well suited. We look at ourselves as mentoring students, as wanting to develop relationships with our students so that they can become exemplar public health professionals during their program and upon graduation as well. So we do have an interprofessional curriculum, which means that some of our classes, we're already beginning to work as teams. In public health, we never work in silos. We work with physician assistants, nurses, nurse practitioners, health administrators. And so because the College of Nursing and Health Professions at Valparaiso University houses all of these programs, you'll have the benefit of having classes alongside some of your peers working in some of these other roles. We do have an online format which allows for both synchronous and asynchronous work. And so the asynchronous work, it is when we look at a 3-credit class being 150 minutes across a week, we look at our asynchronous work as being 70 minutes, and our synchronous work as being 80 minutes. And so that asynchronous work, you can do at your own pace, 24/7, wherever you are sitting domestically in the United States or around the world, that can be done at the comforts of your own desk. And then we do have a live discussions. And that's really where you're bridging what you've learned in the didactic material in the asynchronous work and bridging it with experts in the field. Our faculty is diverse in nature, and so we have faculty from all over the globe. And so you'll have that experience in being able to work with faculty who are able to share their experiences with their own public health systems. We do have international and domestic internships available, and I'd be happy to answer questions about those. And then, as Monica mentioned at the beginning of the webinar, we do have a BSPH, so a bachelor's and a MPH bridge program that combines four years of an undergrad degree, where the last year, as long as students maintain a 3.0, they're eligible to move into graduate level classes in their senior year. And then that means only one additional year to achieve that MPH degree. So it really does shave off about a year of school. Next slide, please. So in looking at the curriculum, we have core courses in public health that we do teach. And students, what you're able to do at a master's level is really gear these courses, even though they are core courses, to your interest areas. And so if you're interested in ultimately working within the United States, you would take your biostats course, Public Health 503, but any assignment in there you could gear towards data within the US. And the same would be true if you're interested in working globally upon graduation. You could gear that data that you're collecting and looking at within the context of this class to your interest areas. So it does, in my opinion, make learning a lot more fun. We also have environmental health, and then biologic basis of disease. That wraps up the first year. And then the spring of that same year, social, behavioral, and cultural health, where you're learning more about the social determinants of health, epidemiology, and then the first class in global health systems. Next slide, please. Electives are interesting. They're slated here for summer, but with students who are in the BSPH MPH 4+1 program, this is the ideal time to take those electives. But they truly, especially since most of our students are very strong students, can really be either added to the spring semester for BSPH, MPH students in that 4+1 program, or taken during the summer so that their second year is a little bit lighter. But for our traditional MPH students, you can stack these into either your first year or your second year if you are able to have or desire to have that summer off. We find that continuous enrollment really helps students to be engaged. So we advocate a little for summer classes, but at the same time, we certainly understand work demands, and perhaps that's what's happening today. A lot of students who are interested in our program, public health is calling. And so they perhaps have had work demands sneak up into this year. Then when we look at year 2, we've got your policy, politics, and advocacy class, global health theory and education, and then community-based participatory research. And then wrapping up that year, we've got trends in global health, and then that global health internship experience, well, public health internship experience that can be done either in the global health arena or domestically. And then the capstone experience is really just evaluating that internship experience, and also can be done domestically or internationally. So you can see that the entire program is 42 credits and currently can be done in 2 years, but we are working on a plan that will be submitted next year, and 1 year from now, we should be able to roll out an executive plan where people can enter into their MPH and finish that MPH in 1 year time. So that is it for my spiel with regards to the MPH program. It's an exciting time in public health, an exciting time to pursue your Master of Public Health. I'll certainly open up the floor for any questions if you have them.
I actually do have a question.
Yes, Justin, go ahead.
Cool. Can you talk a little bit more about like the internships and like what connections like Valpo already has like for those?
Absolutely, absolutely. Through our International Studies Office, we have relationships with internships all over the globe. And so our strongest relationships, I can probably speak to those more specifically where I've had students in the past. We have a relationship with a study center, actually a Valpo Study Center in Costa Rica, that has public health internships. And honestly, minimal Spanish would be required to enter into that. And Spanish language is helpful, but there are some workarounds for that. But then we've also had students working historically in Nicaragua and in Haiti, but both of those, because of political unrest in those countries right now, we aren't necessarily able to facilitate travel to those countries, but we're still doing work with many individuals in those countries. And then we've had students in the past in South Africa and Namibia working in public health related internships as well. So that's the global front. Domestically, because sky's the limit. Internships in policy, certainly at the federal level and at the state level, internships in environmental health with some environmental health coalitions around Northwest Indiana and abroad. And we can certainly, because of the flexibility of the program for students during their MPH phase, to either be at home or on campus, that flexibility allows us to develop partnerships all across the United States. And so if a student has an interest in a particular area of public health, because public health, remembering, is the big umbrella, if a student has particular interest in an area of public health, we're happy to work with that student to determine internship opportunities in that student's area that might be applicable to that specific course. Did that answer your question, Justin?
Yeah, thank you.
You're welcome.
And then I have one more question.
Sure.
But for the electives, like, are there like requirements for like what those electives look like, or are they just kind of like any graduate course? To answer that question specifically, they are open electives. So a student could take them in a variety of different graduate level courses that the university offers. There are graduate level courses in math modeling and things of that nature that someone interested in biostats might be interested in taking. But there's also, there are public health specific electives. This next year, we're going to be offering a public health preparedness, quite timely, elective. And so looking at our current public health situation as it pertains to COVID-19, but within a public health, the wider public health preparedness under that wider umbrella. And then we also have a health promotion public health elective that's very specific to health promotion, disease prevention within populations. And so we're continuing to build those electives, but there are lots of electives at the graduate level that are applicable or would be applicable, and we would just help students navigate which one of those might complement his or her curriculum and desired trajectory for future career, and help match those electives up with the students' needs. This past semester, we had students taking a sociology class that they found quite complementary to what they were learning in at least some of the earlier classes in public health. Thanks for asking. All right, Monica, I think it's you.
Okay, thank you, Amy. I want to introduce to you the graduate school staff. We're a small staff, but what we find is really nice is that we all communicate with each other fairly regularly. We are really separated between two different sections within the graduate school. Admissions, which is Ryan Segali. He is the Director of Graduate Enrollment Operations. And then myself, I'm the Assistant Director of Graduate Admissions. We are the admissions staff. We help with everything from the early stages of thinking that you're applying to graduate school, wanting to learn more about programs, your options, to all the way through the application status and decision phase. You'll start seeing a lot of communication from me, then turning over to Jessica Segali and Stephanie Kincaid. They are part of the Student Services and Academic Services team. Jessica Segali is Assistant Director of Academic Services, and Stephanie Kincaid is the Assistant Director of Student Services. They work more with students once they are actually students and have become gone from a stage of enrolling in courses and are in current status all the way through graduation. So they're the ones that plan your graduation ceremony, events like Dean's List, and we have a reception typically at the end of each semester celebrating students. They're the ones that typically plan those events. We also have an important staff member, Marsha Gearhart. She's administrative assistant to the dean. So she helps us with a lot of financial questions. She really is the glue to the team. So we really like having a nice small team to be able to communicate effectively between the five of us, especially when we are trying to work with the student from the beginning to the end stages. Just a quick overview of the university. While the graduate school was founded in the 60s, we have a long history within the university as itself. We were founded in 1859. We have a beautiful campus of 350 acres. and over 60 buildings. Hopefully once things calm down and we're able to have students on campus, if you are interested in a campus tour, I'd love to give you a quick tour. It's a little bit different than what we give for undergraduate students. I like to really walk you around the campus and the buildings that I feel are most used by graduate students. You're not going to be walking around campus all day like a typical undergraduate student, but I feel that places like the Christopher Center, the VUCA, the Union are really important buildings for you to know. And so it's a nice quick walk and being able to see the different types of services that are offered in each of those buildings. We do have a diverse campus of not just students of diverse backgrounds, but also of age. Within the graduate school, you'll see students that are traditional right out of undergrad all the way to their 60s. So it's a really nice way to immerse yourself in students from different backgrounds, different situations, especially if they have familiar or personal obligations they need to obtain. You're really going to immerse yourself in a wide variety of different cultures and just a diverse background in general. The graduate school was established in 1963, like I mentioned, and we are just under 500 students. So it's going to be smaller classrooms than you're used to probably in your undergrad, which I find really nice. You're going to be prepared for more professional degree, which I feel is really important to have that one-on-one attention with your professors and the faculty. You want to make sure that you know your cohort really well, and that's something that we do take pride in. We have students from all over the globe. We work closely with our international population, making sure that we're working with them on their I-20s, their visa status, so they can come and experience the United States and be able to study here. So that's one aspect that I find very important. When you start working, you're going to be immersing yourself with students or people of different backgrounds and educations and ages. And so I feel that doing that early on within your education is really important. Within the graduate school, we offer around 40 majors and certificate offerings. So if you're interested in tacking on maybe a trauma care certificate with the program or wanting to go for a second master's degree, that's something that we can talk about and seeing, what your plans are in the future. We take pride in our accreditations and affiliations, and these are ones that have to be met every several years. So depending on the affiliation, these are certain standards and high standards that the department has to maintain. So depending on the program that you're interested in, there is a certain set of standards that the department has to make sure they uphold. And that's really nice too, because we take record of our students, what they're currently doing, what they do after post-graduation. So depending on the program that you're interested in, there's probably an affiliation or accreditation that the program has to uphold. We just updated these to 2020, but they are the same standards. We're committed to excellence, so we try to keep our programs very affordable, good return on investment, and we try to make sure we're staying in the top of the rankings. Some things that make us different from other programs, it's really the quality. I always love hearing from program directors and faculty and just how much pride they take in their program. One thing that I find is very important in a graduate program versus undergraduate is the professional preparation. You're going to do a professional program. So there's not going to be any business work. All the work that you're going to be doing is really preparing you for your future career, which I find is really important because in the graduate studies, it's less credit hours than undergrad, but it's going to be a lot more focused on your professional goals. And that's something that we want to make sure that you're prepared for after you graduate. We have academic and classroom support as well as advising support. We just had our symposium today, so this is a great opportunity for you to feature any research that you have been wanting to do. And this is the first year that we've done a virtual symposium, which was really interesting, and it's going to be recorded and was open to the public. So if you're interested in any research in the future, this is something you could be a part of. We also have the Graduate Student Advocacy Council. If you want to be a part of this council, it advocates for graduate students. It lets you have a voice for yourself, for your fellow graduate students, and offer suggestions to help improve the graduate school or anything else. We also offer social events. We try to do a picnic in the fall. We try to do Dean's List receptions. And what I find is these intimate studies help you not only immerse yourself within your program, but also meet other graduate students from different programs as well. And then we offer a graduate banquet once you're getting ready to graduate, just to celebrate the accomplishments that you've achieved right before graduation. And then we'll host an orientation every semester. So say, Justin, you enroll in the program, you'll be participating in an orientation that will allow you to register for classes, learn more about the different student services. It's a great way to just introduce yourself to the graduate school. So different options that we have for students to start the program. If you are currently an undergraduate Valpo student, you have the great opportunity of really taking advantage of the early entry degree program. What I love about this program is that you save time and money. This is a great opportunity, especially in your junior year, towards the end, to talk to your advisor. And these are the early entry degree program options that we have for our students. This allows you to take graduate coursework while still in your undergrad and have it count for both. Now, it's important for you to talk to your advisor and myself to get started and to actually officially apply into the program, because we want to make sure that we cross our T's and dot our I's on everything that we're doing, so we ensure that you're receiving credit for not only for your undergraduate study, but also for your graduate study. One question I get asked a lot is, as an undergrad, I'm part of a scholarship program, or I currently uphold these financial aid requirements. How is it going to affect that status? It's not going to affect it at all, actually. You're going to be considered an undergraduate student up to the point of graduation. Once you matriculate into graduate school is when you actually are considered a graduate student. So it's a really nice plus. You get to take those courses as an undergrad and receive credit. Most programs, you only have an additional year. Obviously, it varies depending on program, but it's a really nice incentive for you to, if you're already in school and are thinking of possibly doing grad school, why not just do another year and save on that time and money? Especially now, if you're unsure what the job market may bring, especially for certain programs, or if you want to give yourself an edge. It's a really competitive market, so it's a really nice opportunity for you to be able to take advantage and take these courses. And especially since you're already used to taking courses, doing that additional year is a really nice thing to do instead of holding off until later. We made a really quick image for you to understand the process. I actually have a one-pager that I can email you. It has more into detail how the process will work and what step to take first, and how to talk to your advisor, what will happen. One really important step is completing the early entry worksheet and registering for those courses. So like I mentioned, it's really nice if you are a junior or becoming a junior, keeping that in the back of your mind. I think I may want to do early entry. I think that's something I want to do. I think I want to pursue my master's and just take that extra year to study and then receive that degree. So really, these are the easy steps. Your advisor and myself are really the main people you want to talk to. I provide the application fee waiver and just make sure you're applying to the appropriate, you're doing the appropriate application, and then you'll be working with your advisor the rest of the way. So it's a really nice, seamless process. A lot of our program directors or faculty are really immersed with the undergraduate students and graduate students, so you'll be seeing them throughout the entire early entry degree program. Now, as far as the admissions requirements, we ask that you complete an application profile, and this is for all students, not just early entry, just generally, and this is for U.S. applicants. The application profile is really important that you complete that first and actually submit it. Some students get a little bit confused and they think they have to submit all items prior to submitting the profile. We want to see that profile because they'll give you access to a portal. That portal will provide you access to your letter recommendation online form. It'll also give you a checklist. It'll make you really proactive on what items you need to still submit. It'll also allow you to submit those items electronically, which we really like for you to do because it lets you know what's submitted or not. I also like to help you through that process and provide you updates. I always ask that you give us 24 to 48 hours. Sometimes we see things on our end that you may not see until that time. So it's really nice for you to check with us just to make sure that something's been submitted or not. The application fee is waived if you participate in a webinar like this, or if you engage in a phone conversation with me, just let me know. Again, that's why the application profile is so important that you submit, because I cannot waive the fee until the profile or the form is actually submitted. So that's really important. We ask that you complete and submit a reflective essay. This allows the program director, anyone reviewing your application, the opportunity to get to know you a little bit more. What are your goals? What are you looking to do with this graduate program? Why is it that you're interested in public health or any other program? We really want to make sure that we get to know you a little bit more. So we typically ask 1 to 2 pages, double spaced, and just really is an opportunity for you to be able to tell us everything that you want to express within the reflective essay. We ask for 3 letters of recommendation, and this is also another plus for any College of Nursing and Health Professions student. If you are a past BU grad, are currently an undergrad and are looking to graduate and are looking to apply into a graduate program, we waive that 3rd letter of recommendation. Again, that's something that sometimes we don't catch right away until the very end of reviewing your files. So if you want to let me know right when you apply, hey, I'm a BU student or I'm a BU grad, would you mind waiving that 3rd letter of recommendation requirement? I'll be happy to waive that for you. Typically, we recommend that you use our recommendation form. It's just very seamless. We get a great turnaround time because it's more of a form style and questionnaire, but we are very happy with receiving the traditional letter of recommendation as well. You may upload that directly. You may send it to me. Your references may send it to me directly. Whichever way, we'll be happy to add that into your file. And then we ask for official transcripts. We may be able to accept unofficial, but as far as being able to register for courses, official are required. Again, if you are a BU grad, we'll obtain those documents for you. One thing that I just find a lot easier is that most institutions offer a parchment service. Just have an email to the graduate.school email, or even myself, and then we receive that within 24 to 48 hours. If some schools don't have that service, you may have it sent over to the graduate school, and I'll be happy to provide you an address if you really need to have it send it more in a document physical form. There's a few additional requirements that we ask of our international applicants. Again, the top few are all the same. Official transcripts must be both in original and English versions, but we've pretty much been able to see most transcripts come through. We're pretty familiar with them, but they still need to be translated so we can make sure that the classes that you've taken, we can pretty much correlate them to the program that you're applying to. We ask for English language proficiency exam. So we have the IELTS, the TOEFL, the PTE. We also accept the ESL program, and all those scores are listed on our website. So I'd be happy to send you that link if you want to know the exact scores of what we typically accept. We are finding that through the pandemic, there's difficulty with students obtaining scores because they cannot take them due to the lockdown. So things like the proof of financial support, the English language proficiency are things that we can, if you email me, we can try to work around and see what we can do. But just know that something like the proof of financial support is important in order for you to obtain your I-20. So though we may be able to waive it for the admissions process, it will be important for us to obtain that in order for you to receive your visa. So that's something to just keep in mind. Proof of financial support documents are all listed on our website as well. And there's a lot more in detail of what is considered a proof of financial support if you have any questions. Another item that we do require is a copy of your passport. So feel free to take a picture of it, send it over to me or the graduate school page, and we'll upload that to your file. There's several things that happen through the application process. So once your application is actually completed, and that means all items are submitted, you see check marks all along your checklist in your portal. Then we send it over to the admission team, which is myself and Ryan. We do a final run through, make sure everything looks good. and then we send it over to the program director. That's typically where it takes the longest, because they're going to review everything from your letters of recommendation to the classes that you've taken in the past. So they're going to be reviewing your entire file. And then once they make a decision, it's sent over to the dean. The dean typically just does a final run through, check, and then it's sent over for an offer letter process if you are admitted. You'll first receive an email notification, so that's really nice that you don't have to wait. It'll be given in your portal. You can access it. If you, for some reason, are not able to find it, I can always resend that to you. It's going to be an important document, because that's going to provide you the next steps for the onboarding process if you are interested. We're going to mail a letter offer as well, and then there's going to be an intent to enroll form that's going to be online that you have to submit in order to just let us know that you're considering Valparaiso. Once that is done, it's just registration orientation. So it's fairly simple, but again, feel free to email me, contact me if you have any questions. I can also just do your intent to enroll confirmation manually, so that's something that I can do also if you have any questions. And then there's going to be just a registration orientation communication sent after the fact. So some students get a little bit confused. They want to know what orientation is. Jessica will be sending you that information once it comes closer to the date. Just a quick rundown on tuition and fees. College of Nursing and Health Profession programs is $7.15 per credit hour. The credit hours is different master of public health, so excuse the 45. But if you want to calculate 42 times 7.15, and then if you want to look down below, there is a part-time and full-time graduate general fee. So if you're going either part-time or full-time, you want to consider that additional $130 or $260 per semester. One thing that I do have found, especially going to different conferences or just asking around, is that we really try to stay competitive within the Chicagoland region. So if you consider the time that is taken, especially if you're going into early entry, that's going to be a nice cost savings. But if you consider other programs, or if you want to talk to your employer for tuition remission, that's also a nice option. We offer financial aid options for students. If you are looking to seek a loan, you will have to complete a FAFSA. And then in order for you to receive that, you will have to at least take 6 credit hours. And we have the financial aid office to be able to assist you with that. Maximum federal unsubsidized loans are $20,500 for the year. And students sometimes want to know, how would it work if I'm paying for half and need to take out for the other half, or if I want to consider the cost of living in there, or daycare. We have our financial aid reps that will be able to assist you with those specific questions. And you may email them at finaid@valpo.edu. So those specific questions are something that we always ask. You specifically ask financial aid because they'll have all your information once you do complete the FAFSA. And then just follow us on social media. We'll try to post any fun photos from past events, any upcoming webinars like this one. We'll post alumni stories. So make sure to follow us, especially on Facebook or Instagram. We try to stay fairly active on there. Any upcoming important news that Valpo shares, especially in regards to when classes are going to start, or any updates, we try to post on social media so that you're aware and up to date.